Hello and welcome to yet another new video. In this video, we want to cover osteosarcoma. First of all, where are we? We are looking at the tumors of bone. Tumors of bone are classified like this based on the histologic derivation. You have the bone forming, cartilage forming, hematopoietic tumors, unknown notochordal tumor. These are all osseous. Non-osseous we are not covering here because it is not, it is something other than the bone. So here, osseous tumors, bone forming, in that we have again two categories, benign and malignant. In malignant, osteosarcoma, that is osteogenic, osteoblastic, bone forming, osseous tumor. Got it right? What is osteosarcoma? Malignant, osteogenic or osteoblastic, bone forming, that is nothing but bone forming, osseous tumor. Okay. Now in osteosarcoma, there are two types, classic and surface. Mainly classic is what they will mean if they don't tell specifically what. But in the exam, they have asked osteosarcoma. And they have asked so many times that it is better you know every word about this osteosarcoma. If they ask osteosarcoma, write both classic, surface, everything. What you can see here, it is first of all, it is malignant. Actually, it is highly malignant. Okay, that you should know. Now, classic is at a younger age, 10 to 20. Surface is at a older age, 50 to 60. Lot of difference in the age. That much you should know. Okay, right? Then where does it occur? Osteosarcoma occurs in the metaphysis. Metaphysis. Where it went? Okay, this diagram. See here, this is the femur, this is the tibia. So in the epiphysis, we saw giant cell tumor, that is osteoclastoma. Now we are moving to metaphysis. Especially femur lower end metaphysis, you will have osteosarcoma. Here the red you see, osteosarcoma. It is malignant. Correct? Ewing sarcoma is also malignant. Giant cell tumor is benign. That is osteoclastoma is benign. Anyways, you know osteosarcoma is our focus for this video, and it is in the metaphysis that it affects, and especially the lower end of femur, that is knee joint, and even hip bone it can affect. Okay, upper end of femur also it can affect. Femur, favorite place, I think. Femur means all sarcomas, favorite. Okay, now let us go into some textual details. Are you able to see, guys? So we are studying osteosarcoma, very important for exam. It is also called as osteogenic sarcoma. From where it arises? Okay, don't sleep off. 1 second. Okay, great. So it is arising from a osteoblast forming mesenchyme. That is why it is coming under the osseous and in that bone forming. Okay. So osteoblastic it is, bone forming it is, and it is very common. It is a very common malignant tumor of the bone, and it is highly malignant. Highly malignant, this osteosarcoma. It is characterized by something, we'll come to that. Some extra details here, guys. Just see that here it is bone forming, right? So what you will see in the tumor, characteristic feature will be formation of osteoid or bone or both by sarcoma cells. Look at this. You see these pink structures here? Pink, only pink parts, though that is osteoid. So this is characteristic features of osteosarcoma because it's bone forming, correct? And it is osteosarcoma. Pay attention here, guys. There are two types of osteosarcoma. You already know that, correct? Two types of osteosarcoma are classic and surface. Classic is also called as central or medullary, and surface is surface osteosarcoma. There are two types in that again. Anyways, we'll come to that. Here also, classic also there are two types, primary and secondary. Okay, there are two types of classic types. Primary and secondary. Types we will bother later. First, types of osteosarcoma we'll learn. Types of osteosarcoma are classic and surface. Classic is nothing but central, medullary it is. Some details about classic and some about surface given here. Classic, of course, young, 10 to 20, we already saw this. And surface is in older age group, 50 to 60. That's what we saw, right? Let's go back and check. Is it 50 to 60? Yes, 50 to 60. Surface. And the good thing about surface is they have better prognosis. They have two types, parosteal and periosteal. Parosteal and periosteal types. Okay. This parosteal also has one more name. No, what is that? Parosteal is also called as juxtacortical osteosarcoma. Okay, no need to break head so much. There are two forms of osteosarcoma, classic form and surface. In classic, it's affecting young people and it is in metaphysis. Surface osteoma, older people, there are two types, parosteal and periosteal. They have better prognosis. Surface osteosarcomas have better prognosis, which is a good thing. And it affects very late old people, so maybe they don't focus much on it. We should focus more on classic form. Is that bad to say? Okay, now some differences they have given between central and central and surface. Age 10 to 20 years, and this one older patients, we know already that. Sex, common in males, no sex predilection, so there's no gender discrimination in surface. Anatomic site, metaphysis, we already saw this, metaphysis word. Surface can be elsewhere. Location, lower end of femur, very famous lower end of femur. Again, femur lower end in this. Pathogenesis, we will look at that. Behavior, it's highly malignant. So whatever they are saying is actually only central medullary only. Highly malignant, everything they are referring to central medullary only. What is GA? Gross appearance. We'll come to that. Microscopic E is what? Okay, osteoid formation. Then histologic types. Spread and prognosis, poor prognosis, that you already know. Surface has better prognosis. We'll come back to this later. Oh, types also we know, no? In this one, parosteal and periosteal. Here you have primary and secondary. Something else also they have put. Anaplastic means poorly differentiated. So they have put that last. Okay, guys. So in this video, we started off with osteosarcoma. We saw that there are two types, where we'll bring our friend here. Please tell us what you learned so far. We started off with osteosarcoma, and we studied that it is highly malignant, especially the classic one. That is, every time they're talking about the classic only. Classic one and the surface one. They are bone forming, malignant, osteoblastic or osteogenic tumors of bone. They are osseous bone tumors. And then, once again, in that we saw that there are two types, classic, that is central medullary, and the other one is surface. So, central one or the classic one occurs in younger age, and it affects the metaphysis, especially the lower end of femur and the upper end of humerus. Then, it is highly malignant, and the classic one has less prognosis, poor prognosis. However, the surface one has better prognosis. That's all I think. What else we missed? Let's see. This is where we started off. Highly malignant is the classic one we'll put. Highly malignant is the classic one. Classic one is highly malignant and it has poor prognosis. Okay, and it's around the metaphysis. All these are specific for classic form only. Guys, then moving on, what will we see in the future videos? We will study more about this classic central medullary osteosarcoma, in which there are two types, primary, secondary. Very important this is because it's very common, highly malignant, occurring in young people. Okay, poor prognosis. That's why probably this one is like, this one is what the focus is. Then we look at the clinical features, gross, microscopy. We saw that osteoid formation and all that. Okay. Then we look at the variants of that. Then we will look into surface osteosarcoma a little, maybe not much, morphology. Okay, that's all. So that's what we have to look at. Then we will go to chondrosarcoma. That's a different topic altogether. Okay, you understood, right? So we will cover classic and surface. In the next video, we'll start off with the classic, that is the central medullary osteosarcoma. See you. Bye, 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 bye. Say bye, baby. Bye, bye.